Christmas, let's talk New Year's. All right, as 2024 approaches, a lot of us may be gearing up to tackle some resolutions, hitting the gym, learning a new skill, or maybe getting our nutrition in check.
There are lots of things that we can do to help set up for success with these goals. And here to help us do that is Dr. Megan Markey, licensed psychologist with St. Luke's Health System. Doctor, thanks for being in here today. We're going to jump right in and just check in with the question that it's fairly common. So how can your weight impact your mental health or emotional wellness, and then vice versa? How do they impact each other?
Absolutely. Well, in my role as a health psychologist, I specialize in the overlap between physical health and mental health. And we really know that things like our mood and our mental health can relate to our health behaviors. Right? I think a lot of us can relate to the idea of having a stressful day and finding ourselves digging around the pantry for something to comfort us. Also, the relationship goes the other way in that our health behaviors can impact our mood and our mental health. For example, that positive feeling we get after we've had a good workout. In my role at St. Luke's, I primarily work with patients who are preparing for and undergoing a weight loss surgery. And we know that people who carry increased weight are at higher risk of having challenges to their quality of life. Like a lot of my patients will say that they have trouble interacting and being as active with their family as they'd like to be, or they're at increased risk of other health behaviors that can be really stressful. But luckily, we know that as people work on growing their health behaviors and they access additional resources like medications or surgeries, this can really make a positive impact on health and quality of life broadly.
Absolutely. And you mentioned a weight loss surgery there too, which can be a big step for some people. What mental health programs does St. Luke's offer to patients who are considering weight loss surgery, and how does that play an important role in their success afterwards?
Absolutely. Our mental health team here at St. Luke's, myself included, works with patients in a few different ways. Every patient that goes to the program does a pre-surgery mental health evaluation with myself or one of my colleagues. And in those evaluations, we really talk to patients about their health behaviors, their mental health, and their expectations for surgery. And then for a number of patients, we'll also work with them either before surgery or after surgery on all the things that they're taking into account as they prepare for and then they recover from surgery and adapt to that new quality of life.
Yeah, and as we are setting those New Year's resolutions or preparing to, what top tips or strategies do you have for developing those good habits?
You know, I think New Year's can be a great time to set some new goals. It's a time that we're establishing new routines after a busy holiday season, also planning for the year ahead. I usually encourage people to start from a place of self-compassion. Really truly believing that we are enough just the way we are. And then from there, being able to establish some growth goals. So goals that are related to our values, that feel meaningful to us. And then once we've established those goals, really thinking about and focusing on the system that we're going to use to help us support those goals. We know that systems tend to be most effective when they are specific, achievable, and measurable. So for example, when we are thinking about setting goals, instead of setting a goal like, I would like to be healthier next year, setting a goal like, I'd like to walk 1,000 more steps per day, and then using things like a step tracker to help manage and track those goals. I will say on the note of trackers, self-monitoring or monitoring what's going on with the goals tends to be a really powerful tool. So that's the number one thing I recommend to patients, whether it's using a habit change app or just writing in a notebook what they're noticing with the behaviors that they're working on.
And you know, it's easy to set a goal and to try and execute it, but sustaining that goal can be really, really tough. How do we keep with some of these New Year's resolutions that we're trying to make?
Absolutely. Keeping up goals long-term can be a real challenge. One top strategy I recommend is trying to make it a seamless part of our routine and our lifestyle as we move forward. So some things we'll often talk about are setting reminders, like using pill boxes, setting phone alarms, really putting the new behavior on our calendar so it stays on the forefront of our mind. Also trying to integrate the behavior into other important areas of our life. So if spending time with family and friends is important, for example, then maybe starting to try to cook with my kids or bring a buddy to the gym with me. Another layer that I'll often talk about with people is about trying to see the new behavior as a part of our identity, of how we see ourselves moving forward. So using terms like I am a non-smoker or I am an exerciser can really help as we hit those natural ups and downs that will happen with behavior to help us return to the behavior if we see that as part of who we are moving forward.
Absolutely. Well, Dr. Markey, thank you so much. This is great information. And for more information, you can visit stlukeskc.org/weight loss.